Good afternoon, everyone. Welcome to part 5 of our CalAIM educational series. Today, the topic will be empowering providers and care managers navigating CCHP benefits. All right, so first up that we are going to have Dr. Joseph Cardinale going over Medi-Cal RX policies. Feel free to go, Joe.
Thank you, Peja. So what we're going to go over is a quick overview of CCHP Medi-Cal members' prescription benefits and how they're administered, and a few tips to help providers and case managers get through the system. So the first thing is there's two parts of medications. Sorry, I apologize for the siren in the background. We'll give it 1 sec. Okay. So there's two parts of prescriptions. There's the retail pharmacy benefit, and then there's physician administered drugs that are done through the doctor's office or through like an infusion center. What we're going to focus on mostly today is the retail prescription drug benefit. And this is done through Medi-Cal RX. The physician administered drugs are through the member's medical benefit, and that's administered by CCHP. So the retail prescription drug benefits, as I said, are through Medi-Cal RX. Medi-Cal RX controls the formulary, they control the authorizations, and this has been in place since January 1st of 2022. DHCS manages Medi-Cal RX through a company called Prime Therapeutics. Okay, so as we said, the medication formulary, what Medi-Cal RX calls their covered drug list, their CDL, and all of their criteria for any non-formulary medication is not hosted by CCHP. CCHP unfortunately has no control over this. It's all done through DHCS, through Prime Therapeutics. They do have a formulary posted on their Medi-Cal RX website. And if you get the slide deck, the Medi-Cal RX website link is on there. But if you go to Medi-Cal RX, there is a tab that has contract drug list. And this has, and I'll show on the next slide what it looks like. It has links to their standard contract drug list, which is up top, as well as all of some of the specialty things that they cover. As you can see, it talks about the over-the-counters they cover. It talks about their diabetic testing supplies, their enteral nutrition, pen needles, etc. All the way down to one that we're going to talk about in a little bit is CGMs. But it has, when you click on each of these links, it will take you to their contract drug list and show you what's covered. If a medication is not listed on the contract drug list, it means it's not one that Medi-Cal RX will cover without a prior authorization from Medi-Cal RX. So if it is not covered medication and needs a prior authorization, these prior authorization requests are sent to Medi-Cal RX via Prime Therapeutics. They have a 24-hour turnaround. So if it's sent in, their turnaround time, they should be able to get back to you within 24 hours. If it's been longer than that, that is not normal. It's something I would definitely follow up on, because sometimes things either get, what we've noticed is they get lost in transition somewhere, or something gets to the physician doesn't turn it around, or that there's some things that don't require an authorization, that an authorization sent in for some reason, and Medi-Cal RX will just close it. So we always tell people to watch for that 24-hour turnaround once the physician has sent in the authorization. Providers have multiple different ways they can submit prior auths to Medi-Cal RX. Obviously, mail, fax. The one thing that we like to tell people The most successful ways that we've seen have been the provider portal through the MediCalRx website. But most commonly, what we've seen providers have success with is through Cover My Meds. Cover My Meds should be available for most providers, and it seems to be where we've seen providers have the most success getting turnaround times and messages not being missed. So if a medication needs prior authorization, there are not a lot of public available criteria through MediCalRx. I've tried multiple times to call MediCalRx and say, what's the requirement for getting this medication? It's not something that they publicly share. However, there is a MediCalRx provider manual on the MediCalRx website. There are certain things, especially specialty type items like CGMs, that it does list their criteria within the provider manual. So while there's not a criteria document, it does list some of these if you look in the provider manual. For example, on one of the provider manual pages, and usually what I do if there's a medication that I can't quite find what MediCalRx needs for the documentation, I will just look through the provider manual document, search CGMs, and look until you see. But it does, in the provider manual, for example, have initial authorization requirements for a CGM. There are other specialty type medications items that it lists in the provider manual. So I always suggest, if you're having a hard time getting something paid for, a tip for case managers, nurses, providers would be to look in that provider manual on the website. If MediCalRx does not approve something, members do have an appeal option. Sometimes members don't realize that, and this is something that you can help members with. They can look, and it's usually at a state fair hearing. They have 180 days from the initial denial to submit the appeal. If a provider's submitting the appeal, they must write appeal on the document, or MediCalRx won't view it as an appeal. So we always try to remind providers to make sure to do that. One other issue that we see MediCalRx members run into is, where can they get their medications? There are a lot of pharmacies within the MediCalRx network. The vast majority of pharmacies in the state are in the MediCalRx network. There are a few select mail order pharmacies, and there's pharmacies that can deliver medications to members. There's a few local pharmacies in the area that we know of that deliver. The ways to find what pharmacies: on the MediCalRx website, there is a search tool of all the pharmacies that are in their network. The search tool has a couple of neat features that we wanted to show you. So you can enter the location. If you click on the filter button over here to the right side where it says display filter, it'll drop down this information. This will allow members to look at what pharmacies are open 24 hours, what pharmacies offer delivery, what offers drive-through, some convenience services. One thing to note is these are all options that are clicked by the pharmacy when they enter into the MediCalRx contract. So every once in a while, you do see one that a pharmacy said, yes, we have a drive-through, and they did it one time, but they're no longer operating it. So just be aware for your members that every once in a while, one of these does not end up applying. But this is a good tool for members, providers, nurses to use to try to get a member to something they need, including mail orders such as extended day supplies and mail order services. One thing I always let members know is there is a Medi-Cal RX customer service phone number. They are open 24 hours a day, 7 days a week. They answer almost immediately. They have customer service reps that can direct you to where the member or the provider needs to go, and they can always assist with issues. We've had a lot of success even here in the CCH pharmacy department. If a member is struggling, we'll help call, and we've had a lot of success with the Medi-Cal RX help desk. If there's any questions, while we don't have any control here at CCHP over the criteria, the prior authorizations, or the formulary, we're always available to help navigate. And our phone number of 925-957-7260 is listed here on the slide. Please don't hesitate to give us a call if there's anything that we can assist you with.
Thank you, Joe. Up next, we are going to have an overview of CCHP member services by our CCHP member services manager, Belkis.
Good afternoon, everyone. My name is Belkis, and I will be doing an overview of Member Services Department. We will go over who we are and what we do, how we support our members, and how member self-service tool. We will go over those things today. Who we are. Member Services Department is the first point of contact for members. And the team assists member with navigation, education, problems resolution. Member Services Department help ensure members have access, understanding, and satisfaction. Our goals is to maximize member satisfaction and to ensure effective service delivery. Maximize member satisfaction, well, by responding promptly to member inquiries, solving problems effectively, explaining benefit, policy, and resources, and encouraging a service-oriented culture within our team. To ensure effective service delivery, identify and report issues affecting member satisfaction, improve member perception through education, and facilitating communication between departments, and identify potentially events and trends. Here's a list of what we do on a daily basis. We assist member to choose or change primary care provider. We assist member to schedule appointments. We spend a lot of time educating member about their covered benefits and exclusions. We assist member with ID cards. We verify eligibility. Help member to with claims, bills, place referral for case management. The team also assists member to process disenrollments when they move out of the county. We process interpreter requests. And last but not least, we assist member to file grievances and appeals. Self-service option is a tool that we encourage member to register on My Chart. When they register on My Chart, member, they have access 24/7. Member can change their primary care provider instantly. Member can order ID cards. They are able to see referrals, test results. They can message their doctors. But also, if a member cannot use My Chart, member can go online and use our PCP change form. And this is, they don't have to contact member services. They could do it online. They have access to their member handbook. The member handbook explains information about their benefits and cover and how to use services, explain their rights and responsibility. Also, member can file grievance and appeals, and they also can review the provider directory. They can review who participate with CCHP or not. We have an automated phone system, the same member call center, where member can review their eligibility and who is their primary care provider assignment. But if the member prefer to speak to the team, member services department, the department is open Monday to Friday, 8 to 5, and we are here to assist them. Is any question regarding member services?
So next up, we're going to cover CCHP transportation services, and that is going to be Cynthia.
Hello, everyone. Hope everyone's doing well. Thank you, Peja. I'm happy to be here today, and I'm going to be giving a quick overview regarding non-medical transportation and non-emergency medical transportation. So what do you know about CCHP transportation services? What type of transportation services does CCHP offer? And how can a member request transportation services? This is what we will be discussing this afternoon. You're going to see this phone numbers a few times throughout the slide. The Contra Costa Health Plan Transportation Line, 855-222-1218. You can also call the main line. You can reach us through member services, but the best number to call for transportation is this number here. We service the non-medical transportation department. With non-medical transportation, we offer bus tickets, transportation tickets, the car, which is Lyft and Uber, or taxi rides. And the medical appointments or for Medi-Cal covered services. We do not give rides to the grocery store, but to all medical appointments we will. Non-emergency medical transportation, which we call NEMT, that service ambulance, wheelchair vans, litter vans, gurney, or air transportation. For members whose Medi-Cal conditions prevent safe travel by regular cars and bus taxis. NMT services must be ordered by a healthcare provider. That is a very important part. There are just a few limitations, not many, but CCHP provides the lowest cost ride that fits your needs. So if you live close to a facility that's about, let's say 20 minutes away for public transportation, we will provide bus tickets to that member. If it is an hour and a half away, that is a long ride, we will make sure that they either have a Lyft, Uber, or a taxi. And all services must be covered by Medi-Cal. Again, here's that phone number for you. You call this number here for transportation. You should call at least 5 to 7 business days in advance for NMT, which is the bus, paratransit, car, or taxi rides. And it's 7 to 10 business days in advance for NEMT. That's for the wheelchairs and the gurneys and the ambulance. Try to call as soon as possible for any urgent appointments. If you need to cancel or reschedule, call as early as possible to avoid delays or missed services. We're going to just go over a little bit with the non-medical transportation. Our phone lines here are Monday through Friday, 8 a.m. to 5 p.m. Again, 5 to 7 business days in advance, or for urgent rides as soon as possible. Non-urgent requests received less than 5 business days may be denied, but we will do our best. So I'm not going to say that we're going to deny, we're going to put the best effort into trying to get those done. And you are also able to book your rides within 1 month in advance. So you can book for the whole month of June. You call June 1st, you can book it for the whole month. When calling, you must have the ride details ready. We need the date and time of the appointment, the provider address and phone number. We will not look up the phone numbers for you or the provider's address. We want to make sure that we have the correct information when we drop you off. Urgent requests made after hours or on holidays will be arranged by the advice nurse. Each member is allowed to have an attendant. It's one attendant. If they do have multiple children, that is fine. Please notify the member service counselor when calling. Anyone under the age of 18 can only be permitted if they have a consent form signed by their parent or guardian, seeking sensitive services, or incapacitated. So remember, these is very important. If a 16-year-old calls us and they do not have permission with any of these, we cannot submit transportation. We will not submit the request until we receive a consent form signed by a parent. We do not provide car seats. You are responsible to bring your own car seat. Again, if you are canceling any appointments, please call to cancel the ride. If it's a taxi, at least 1 business day in advance. And then we're going to go over in EMT just a little bit. Transportation hotline is available 24/7 for members. If you call the 855-222-1218 phone number, you can press option number 2. That is a 24/7 line for NEMT. Again, it's 7 to 10 business days. For urgents, as soon as possible. Upon calling, it's the same thing as far as the details, but we're going to add that we need the pickup and drop off address and length of appointment, which is very important because we are dealing with the ambulance services and wheelchair vans, and they will need a pickup and the length of the appointment time. If you call the non-medical transportation line and they are unable to confirm the appointment, the NMT transportation may not be arranged, but we can look into it for you. Very important, again, the provider must request NEMT by submitting a prior authorization request and a physician certification statement, which is called the PCS form. CCHP must approve the authorization. Again, remember to call when canceling. If you have any challenges here, you can reach Brandon, which is our director, Belkis is the manager, and myself, which is Cynthia Laird, by email or by phone. And this is just little information. You can submit your authorizations and your orders through the CC Link order or the provider portal. So there are some strict requirements of what CCHP needs to have on file to authorize. So we do need the PCS forms, which is very important. A date range, you can date range it for up to a year. What mode is requested? Is it a gurney or wheelchair? Why the patient needs the NMT transportation. And it will need to be signed by a provider. It can be a nurse practitioner, podiatrist, mental health, and etc. But we do have to have that signed, and it does need to be authorized prior to receiving transportation. I just wanted to show what the form looks like. So this is the PCS form I was referring to. If you see, every field will need to be filled out correctly. If it's not done correctly, the authorization cannot be approved. So we will need that. There is codes. There is the CPT codes that would need to be in there. We need to know what mode of transportation. So when filling out this form, please take the time to pay attention to fill out everything so you won't have any delays. And so we do have a couple exceptions for the NEMT. It's not required if a member is transferred from an ER to an inpatient setting or a form of acute care hospital, immediately following an inpatient stay in an acute level of care, and you see to a SNF. So these are a couple things that are accepted. NMT must provide within 3 hours of the member or provider's request. Otherwise, the acute care hospital may arrange, and CCHP will cover out-of-network NMT services. Okay, and again, here is the, if there's challenges that need to happen right away, and then you have questions, please reach out to Belkis or myself, and we'll be happy to help you. Thank you guys so much for your time.
Thank you, Cynthia. Up next, we are going to have a review of our CCHP Advice Nurse Unit by Ms. Patricia Munoz Zuniga, who is their Nurse Program Director.
Good afternoon, everyone. I'm going to be giving an overview of the Advice Nurse Unit. First, we'll start with a little bit of history. So, Advice Nurse Unit is part of the Contra Costa Health Plan, and we operate 24/7. And currently, we only provide telephone services. So we first started in 1986, and it was just a Monday through Friday service, and it was just for CCHP members. And years after that, we actually expanded to include not just CCHP members, but also to provide services to any residents of Contra Costa County that did not have a private insurance. Oops, sorry. Waiting to... And then in 2012, as a result of the Kaizen Lean project, our telephone clinician consultation clinic was developed. So the advice nurses still conduct a triage, and then based on the outcome, they can actually refer to what we call the TCC clinic. They'll make an appointment, and then the TCC providers will actually call the patients within 24 hours. And most of the time, they'll call the patients that same day, but they do have 24 hours to call them. And TCC operates 7 days a week. It's usually 8 to 5. And all the providers who work the TCC clinic are providers who work within Contra Costa Health Services. And currently, we have a 90% patient satisfaction rate, which is really good. And about 88% of our patients who are referred to CCC will have their medical needs met without having to have a face-to-face clinic appointment or having to go into emergency room or urgent cares. So we're really, it's a great service that we provide. So we are part of the disaster service workers, and our unit actually becomes the primary point of contact for any type of emergencies that happen. So like was the case with the H1N1 or the measles outbreak or the most recent, COVID-19 pandemic. So we became the first line of contact for anyone in the county. They were able to call us so that we could provide information about just different services. So currently our team consists of 29 RNs, 4 LVNs, 1 information assistant, 2 supervisors, 1 for day shift and 1 for PM, and then a program manager. And our nurses, what we do is we provide ongoing training of any policy changes, workflow changes, any guidelines, or any laws or regulations that have changed that will affect the telephone triage that we provide. And we also provide in services for our nurses. Our assistant medical director will also start providing in services for our nurses. And we do check the nurses' license on a quarterly basis just to make sure that it's up to date. So on a yearly basis, we handle about 160,000 calls, and we have an abandonment rate of 2%. So abandonment rate is the number of calls that are either dropped because of a high, if they have to wait for a long time. So 2% is really good. And we have an average answer time of 56 seconds. So the top 10 reasons why patients have called us in the last 6 months, of course, the number 1 is coronavirus, 2 is cough, 3 is abdomen pain, 4 is chest pain, and you can kind of, read the rest, which number 10 being cough non-productive for adult. So our level of care is sort of the calls that we take, about 1% end up going to calling 911. About 16.5% end up in the ED disposition, 10% in urgent care. And then as you can see, about almost 14% of the calls that we take are referred to TCC. And same day is 23%, with home care being the second highest, which 21%. So the services that we provide, like I said, we are 24/7. And then we are here for not only CCHP members, but anyone who lives in the county that does not have private insurance. So what we do is the nurses, all our calls are answered by RNs, and the nurse does a telephone assessment. And then based on the assessment, they will refer to the safest level of care. So the possible dispositions, like you've seen on the previous slides, were, home care, same day, urgent care, also TCC. And the guidelines that we use are the Schmidt and Thompson guidelines. They are embedded within CC Link. And then our guidelines are reviewed on an annual basis by our medical director. Other services that we provide are, we also assist with lab results. As long as the patient has done the labs within health services. We also assist with critical labs. And then also we do assist with medication refills, as long as the patient has already has already requested the medication refill. So if the patient has requested the refill, and for some reason they have not been able to obtain their medication, they can call us, and then we can help problem solve and assist them in getting them their medication. We also provide health education information. We also, as Cynthia mentioned earlier, we also do provide urgent medical transportation, but I do want to emphasize that we only do urgent medical transportation. For anything else, we ask that our patients do call the transportation department. We do also have standing orders that we can call for uncomplicated conditions, such as, cough, allergies, rashes. So the nurses are able to call, medication for certain conditions. We also assist with appointments. So after the nurse does their assessment, if they feel the patient needs an appointment, we do have access to make appointments in our clinics. We also do follow-up calls. So for our members that call us today, we will make a follow-up call just to see, how are they doing. We also make referrals to our care management. And then we do have a medical director and assistant medical director who oversee our department. They are on call for us if we need, to call them after hours. They also approve, like I stated before, our guidelines, but they also approve our policies and procedures, our quality program description, our work plan as well. And one of the things I just wanted to share that we are doing currently is we're working on a project, as in the earlier in the slide before, if you notice, the ED disposition was about 16.5%. So one of the things that we are working on is trying to decrease the unnecessary ED referrals by the nurses. So what we have done is we have identified the top 10 nurses with the highest ED disposition. And now we're in the process of reviewing a certain percentage of their calls just to see was the ED referral appropriate. And then once we finish with the information, we will review the information with the nurses. But also, as we start to review the calls, we've noticed that there were certain guidelines that kept coming up that the nurses kept using that, with an ED disposition. So another thing that we are going to do is we're going to keep track of the 5 type of guidelines that the nurses are using that, with the ED disposition. And then we are going to review those guidelines with our assistant medical director to determine if maybe those guidelines need to be updated. The other thing that we'll be doing is just, our nurses are also to do a consult, are able to do a consult with our ED providers prior to sending the patient to the emergency room. And that is my end of my presentation for Advice Nurse Unit. Thank you very much.
Thank you, Patricia. Thank you, everyone who joined us today. We will be having part 6, Pathways to Stability, Navigating Homeless Services in Contra Costa County on June 2nd at 1 p.m. We are going to have our Contra Costa Health, Housing, and Homeless Services providers, as well as Contra Costa Health Core, and then also our Contra Costa Health Healthcare for the Homeless representative is going to be coming as well. If you would like to go ahead and be added to those invitations for any of our future in-services, please go ahead and send an email to the CCHP CalAIM at cchealth.org email. Any Q&A that we were unable to go ahead and get to today in the live Q&A box, we will have our presenters go ahead and answer those, and we will go ahead and share that with the list of attendees today. Thank you very much, everyone.